was born in Lewis, Delaware, and I was born at home and delivered by Dr. Hiram Burton, who was at one time a congressman from Delaware. Well, my mother was Elsie Kirkland Beebe, and she was born in Olean, New York. And her father emigrated here from Scotland, and she was born like 3 years after he arrived here. Then they moved to Philadelphia, where my grandfather was associated with, I think it was the Atlantic Refining Company, the oil company. And my father, of course, was born in Lewis, and he, after he graduated from high school here, he attended Goldie Beacom, correction, it was called Goldie College at that time. And after that, he worked with a American Bridge Company for a couple of years in Philadelphia before he went to medical school. My grandfather had many occupations. He at one time owned a grocery store on the corner of 4th and Savannah Road. And later, I believe for a time was probably, I heard that he was a postmaster. But in later years, he was a brick mason. And he made all the bricks in the original part of the hospital, all the cement blocks. The reason the hospital expanded like it did, my dad became very friendly with a Benjamin Shaw, who had a plumbing business in Wilmington. And he had a home in Rehoboth, and I guess my dad, he was easy to make friends with people, and he talked to him, and Mr. Shaw told him that he wanted to build onto the hospital because he wanted a nice place that he could go to if he were sick down there. So I think he put up about $50,000, which was a lot of money in those days. And they built on the whole front part of the hospital at that time. In the beginning, there were just 4 beds on one side, and then they built the rest of across the front of the hospital. And that's why it's named the Shaw Building. At that time, it was a private hospital, and he insisted that my father and uncle have 50% and he would have 50%. And then that remained a private hospital until 1935, I guess, when it became a nonprofit community hospital. And it's been that way ever since. Well, I graduated from Lewis High School in 1937. Then I went to Duke University, took pre-medical course, graduated in 1941, and went to Jefferson. And after the first year at Jefferson, that's World War II started. I started there in the fall of 41. Of course, Pearl Harbor came along in December. So in June of that year, the Army decided that they wanted to train some more doctors. And so we had a choice of either going into the Army or the Navy. And most of us decided we'd go in the Army. And we were in what was called the Army Student Training Program, and we were in the regular Army, and as private first class. And we, in addition to going to medical school, we used to have close order drill every Monday morning, and we were restricted like everybody else. We couldn't leave more than 50 miles from from the school without a special pass. But and in addition to that, they decided we'd go year-round. So when we finished school in June of 1942, we just had a week off, I think, and started right back in the next year. So the only time in the history that Jefferson had 2 graduating classes in the same year. I graduated in, there was one graduating class in January of 1944, and I graduated in September of 1944, just about 3 years after we started. Well, for instance, when I first started, penicillin was just coming out. And in my residency, we used to have to give a shot of penicillin every 3 hours. And we'd give them 5,000 units. So we had a patient that was pretty seriously ill after he'd had a ruptured appendix removed. And the chief of surgery then, Dr. Semi, says, I think we better give him 50,000 units. We said, oh, I don't know, that might be too much. So we gave him 50,000 units every 3 or 4 hours. And he did very well. And now they give penicillin in millions of units rather than 50,000. And so, and of course the big problem with the antibiotics is the fact that they were used so much that the germs have become resistant to them. And fortunately, they've been able to develop newer antibiotics that as they become resistant, well, they've been able to find a new one so far to combat that. The main thing about the instruments, I think, is to be we used basically the same instruments when I was a resident as we did all during my regular surgery. One big difference was that we used to have to clamp and tie off all the little blood vessels with and we used regular cotton thread. We used Clark's. We used to use Clark's ONT thread and wrap it around a board and cut it and have the small pieces to tie the vessels with. And then as the electric cautery came along, why, that made that much easier, that you could just touch the blood vessel with the cautery and stop the bleeding, made it a lot faster. And then we started in not only stopping the bleeding, but we were able to use the cautery as a cutting tool as well. And then along came the staples, where you just pull the skin together and punch the staples in. And in the beginning, we used to keep a dressing on the wound for, we'd change it, but we'd keep a dressing on for about maybe a week or 10 days. But got so that a lot of times then we just, later, we'd just leave the wound open after the first 2 days, we'd take the dressing off and just leave the wound open. And they healed just as well, if not better.